Hi, everyone, and welcome to another episode of the Philly Public Health Chats, where we talk about the world of public health and spotlight the professionals making a difference in the field. I'm your host, Dr. René Najera, Director of Public Health for the College of Physicians of Philadelphia, and today I'm very excited to be joined by Dr. Carlene Robinson, a distinguished senior epidemiologist and Director of Data and Evaluation at the Alabama Department of Rehab Services. Dr. Robinson holds a doctorate in public health, specializing in epidemiology from Georgia Southern University, as well as a master's in epidemiology from the University of Alabama at Birmingham. Over the course of her impressive career, she has spearheaded projects focusing on rural health, social epidemiology, and special healthcare needs for children and youth. In today's conversation, we'll explore Dr. Robinson's journey in public health and how mentorship has played a crucial role in shaping her career. We'll also discuss the significance of community engagement and how public health professionals can bridge gaps through effective communication. Thank you for tuning in, and without further ado, let's go ahead and welcome Dr. Robinson to the show. Hi, Dr. Robinson. Thank you for joining me today. How are you?
I'm good. Thank you for having me.
So I thought we should start off by just hearing a little bit about your background, about how you got to where you are and what it is that you're doing right now.
I've actually been in the public health space for about 11 years now. Started kind of as soon as I started college. Just wanted to learn more about the community that was around me. And by my junior year, people started telling me that's public health. Did you know that? So I have my undergrad and my master's from UAB. I got my doctorate in rural health and social epidemiology from Georgia Southern University. So I've been in epidemiology specifically for about 5 years now, and I work on state government projects. So I do a lot of social work activities. I partner with a lot of institutions, and I just have fun doing it.
And it's funny how so many of us were at a point pretty well into our undergrad, even some people that I know now who are working in the community, and they don't realize that the work they're doing is public health. Then it gets pointed out to them, and it's like this light bulb moment of, oh my goodness, I have this entire community of public health workers and public health professionals out there that I can rely on. And it opens up a whole new world to them, right? And speaking of opening up a whole new world, one of the ways that we can do that is through mentorship. Can you talk to us a little bit about the importance of mentorship?
Yes, it has been a helpful thing across every stage of my career, especially as someone who DIY out of not doing necessarily infectious epi or chronic disease epi and being on this smaller pathway where there's less than 100 people focusing on this specific thing. Mentorship is tapping into the knowledge that exists around you. That doesn't necessarily need to be a senior level epidemiologist for me. It could be people who are prominent in just the community themselves. So it could be a pastor, it could be the mayor, and things like that. So mentorship can look like a lot of different things, but it's making sure that what you're putting into something is also something that people around you can get out of it as well.
And one of the other things that I've noticed when talking to students who are looking for mentorship is the importance of representation, that they see themselves in the people who are mentors to them and also in the careers that they aspire to. Can you talk to us a little bit about that?
Yes. So there's a Facebook group called Black Ladies in Public Health. And it's been a very enriching experience because when I started going down a public health path, first it was kind of a lot of white cis hetero men. And then it became white women. And then, like, slowly other cultures are coming into play. And that's great now. But as like you're trying to know the fathers of public health and understand how that walked along its path, it seems very one sided. So, having this whole community where we talk about, like, these are the challenges that you should look out for, and this might be something that's more systematic in the job field that you need to pay attention to. That's been a great community for me.
And I remember one of my first jobs as an epidemiologist was here in Maryland, and we had an outbreak of diarrheal disease. And we went to investigate the outbreak at an apple orchard. And a lot of the folks there, they didn't speak English. They were uneducated or undereducated. And I identified with them because coming from a Latino background, they were all Latinos, and I was able to connect with them. Much to the surprise of my supervisors and to the surprise of my colleagues, they were like, you worked in the fields? And I said, well, not full time, but some summers I did go out. And when I was in high school and college, I did go out to the field because that was easy money, backbreaking easy money. That expands to the work that we do in public health, right? We need to know
Right.
how to communicate and talk to people that we are serving. Can you tell us about some experiences in that regard of speaking the language of people? And I don't mean English, I mean the living experience language of people that you serve.
Yes, my favorite class to talk about was African American health that I took at UAB. We had a project where we had to go into Birmingham, a little rougher area, and communicate these very intense public health topics and then try to communicate them back. It didn't go well. As you learn all this public health knowledge, translating it back might be very cumbersome. And how do you sit back and use a community's language and not just this professional language? They might understand you as the type of person that you show up as. But once you start talking, you start to lose that sense of trust and, like, oh, you're just one of them. You just are the token person to just be on this case. So add some years on of learning public communication and things like that. Recently, I finished a huge project where I was going out into different Alabama communities. Sometimes I had to switch back on my Southern accent and switch on different vernaculars so I could truly extend that, like, I'm here for you and I'm coming to you as you because I also experience these things. And so I don't want to say it's code switching, but it is a little bit of approachability that I had to do in those spaces.
And getting back on the subject of mentoring, what would you suggest to somebody who is starting out in public health, maybe at the bachelor's level, or maybe they discovered it later on, and they want to find a mentor? What would the first step be?
The first step is to kind of understand what you're looking for. I say that there's two big types of mentorship. There's short term and long term. I kind of work in this space for the past 5 years as a short term. So I primarily help students make this big transition into the workforce. This came about because a lot of my classmates were like, what is a program manager? Why is one $10 an hour and one's 120,000 a year? What is this big discrepancy? A short-term mentorship is probably a specialist, probably the exact field that you want to go down into. This is probably, like I said, short-term one-off. Once you kind of complete the goal, then you're probably not overly checking in with this person much anymore. And then you have long-term mentorships, which are probably once you've already like kind of gotten the job, and this is more of an in-house or in-community ongoing connection. And so with these two different types of mentorships, it kind of comes with a different realm of responsibility that everyone takes on.
And, once you're in that mentor mentee relationship, what if it doesn't work out? How do you navigate the breakup, as it were, of the mentor mentee relationship?
Oh, it's very hard. Don't take it personally is my main source of advice. It's not a characteristic flaw of you or the mentor. Some things just don't work out. And it doesn't mean you're not right for that space. Like if you are very interested in infectious disease and you pick a mentor, you guys aren't really speaking the same language or aren't even connecting on things, it doesn't mean you're not allowed in that space. It just means that one person wasn't really meant to bond with you on this project. So that's the main thing. Don't take it personally. We can work through it. So if it doesn't work out with this person, then there's still other people also in the field. I mean, 11 years, I've had probably about 20 mentors. And that's because some of them are short term, like I need to go from this space to this space. I worked in nonprofits for a little while. I did not like it. And so I needed to switch out. And so it required someone with a little bit more head knowledge to understand what that looks like for me. So it's okay. It's more of a fluid dance than a permanent long term partnership.
And likewise, on the other end of this, how do you measure success in mentorship?
A goal. Setting yourself up for a goal and that it gets accomplished. Like for me and my mentees, we're getting to a job space or how to choose my next degree or how to choose my next level of public health. It might be for my long term, which I'm kind of working through now as I'm settling into this one space. It is kind of just always checking in and making sure that as I grow, I'm not losing my own values. That was my goal. I never want to lose the connection to the community that I'm looking out for. So my mentor tells me, have you gone out and done this community event recently? Have you done this? I know you're bogged down with all these administrative tasks, but are you still connecting back to your community? So it's more of like a loving check-in on that side.
And when we talk about the mentees, one of the several things that they get out of it is networking and being exposed to the career or the profession that they're aiming for. But what does the mentor get out of all this?
Wow, that's a great question. I'll speak for myself. I enjoy connecting and learning. My mentees are doing incredible things. I just had one that is now going to be a policymaker in DC. Hopefully, in a few years, I can start ranting towards her about all my public health issues. It's just networking and watching people grow and watching them start their public health journey.
It's funny because when I was growing up, I had a younger brother by 7 years. And then, believe it or not, I have a younger sister by 21 years. And I've always seen myself as responsible to them in how I carry myself and what I do in my life and in my profession, that I don't want them to ever be ashamed or disappointed. And so I've always had that in the back of my mind as one of the guiding principles of how I conduct myself. I try to think about that when it comes to mentees, that, I'm gathering all these people who are not necessarily there to judge me, but they're also there to follow me. And if I want the profession to improve, if in my old age I want to be taken care of by quality people, then I have to prepare them now. And a lot of them do ask that. They ask, what are you getting out of this? How much do you charge for this? And I currently I'm doing it for free, but they ask that, and that's kind of my input into this. I wonder if you felt a little bit of pressure in your professional life, maybe even personal, but let's keep it professional, from having mentees, especially with your success or with projects that you're doing. Do you feel pressure just by having that many eyes on you?
Yes. So my first mentee was thrusted upon me. I was starting my doctorate, and a professor thought I would help this person on their journey. And thankfully I did. But at the time, I was like, oh, I'm in public health, but I'm very entry level. There's nothing that I can share with you. I'm not working on large projects like AIDS and things like that. I'm just asking people in the community if they need cleaner water or if they need baby supplies. Like, it's very, like, don't ask me. I'm nobody. And even as my career has grown, I'm still not working on sparkling projects. So there's a little bit of imposter syndrome as you think, like, really, what can I offer and what can I, truly give to a person? But I always tell my mentees that I give chaos. I've dabbled in a lot of different things. And so you get the ability to ask me, well, how is this different from this? And how is this different from this? Versus other people in my cohort were much more like, I want to work on this one thing. And so they can give you much more thorough, deep level knowledge about a specific topic. So yeah, it's always sort of surprising when I get selected. And then just the feedback during the process, people were like, oh no, I didn't think of it this way. Thanks for telling me about this hurdle that would be coming up. It's a great experience on that side.
And I think I skipped over this part, but we should talk about the initial contact, right? The breakup should be not personal, but in the beginning of the matchup process, how does that work?
I tend to work with mentorship companies now, and so we're matched together. When I was first starting, I just found undergraduates who were looking for some advice. And so that looks a little bit different than what it looks like now. So it was me kind of reaching out, like in a classroom setting. Anyone after the end of the semester want to keep talking, just reach out. And so now it's a little bit more structured and paired out. So I always have a first time meeting with everyone. We kind of walk through goals, we walk through a timeline that makes sense. Let's say, for example, that there's a student and they want to start thinking about what their career looks like. First time, they're about to finish their master's and graduate. So, what does that look like post graduation? We should start early because the job market is kind of crazy right now. So, let me start thinking about it. So, it's November, and I say, we're not going to start job offers, but we're going to get everything lined up. So, this might be interview practice, this might be setting up your CV. And so, I make sure that in that first meeting, I set those goals and expectations so we know exactly where we should be at all times. And this helps me, the mentor. So when I check in and I say, are we having any problems? We can talk through it. And it also helps the mentee not feel like they're just loose and out there and that I don't really care about their overall success.
I signed up for a mentorship program through the Council of State and Territorial Epidemiologists, and then COVID-19 hit. And I found myself apologizing to the mentees a lot. I was working at a local health department. We were dealing with localized outbreaks of COVID. And I kept going back to them and apologizing. And likewise, they were apologizing because they were also busy. They were, also early career professionals at their respective health departments. And it was a lot of apology, a lot of apology. And I think one of the things that we learned after that, and we kind of did a debriefing, was that we should have just not tried to force things and just agreed that we were in a pandemic setting and we needed to step back. Since then, I've had a couple of other mentees through that program, and we've had similar things happen. Life happens, life gets in the way. There's been changes, and we kind of lose track of that. And so we all know about time management and project management and getting to a goal and all of that. But how do you deal with life when life gets in the way? How do you deal with those instances where something completely unexpected happens and then you have to adjust?
Yes, I really try to tell my mentees that this is their path when there's something that comes up on their side. I had a mentee that was in Korea. And so we had a lot of time zone issues, especially because apparently Korea doesn't do our weird twice a year change. Um, there should be things that are done offline behind the scenes, and you can keep doing that without my input. Life happens, things happen. Send an email. Let me know where you are. Maybe we can just do this via email. Maybe we could just do this a completely different time. I think taking the pressure off, and I say this in my career person, but just kind of taking the pressure off of this has to be done today. It's not a deadline. This is the rest of your life. Hopefully, you'll have a long, happy life. And this is like 40 years, 50 years of your career. So you have the time, just pace yourself.
And next to last question, if there was anything you could change about the process of mentoring, what would that one thing be? And how would you change it?
I would like to meet my mentees more in person. I live in Alabama now. I originally lived in Georgia when I started mentoring students. I now see individuals across the country and overseas sometimes. I think having that in person environment would really help. I enjoy the one on one process, but I also think having a collective, hey, did you know this? I am not Gen Z, I'm not Gen Alpha, so I'm also not Gen X. So there's just some things that are beyond my scope of what I'm seeing every day. Just having different perspectives flow in all at once would be something I would like to add to the mentor mentee process.
All right. And then finally, is there anything else you want the world out there to know about the role of mentorship in public health or anything else? Any good advice?
My last piece of advice is know that your mentor is there for support, not to break through miracles. I always have to kind of lower the expectations of what I can do for people. I cannot get you a job at the CDC. I wish I could be there myself, but I will help you get all the steps that you can feel confident that you can get that job. And that's my role, really.
Thank you so much for joining us today. I really appreciate your time. I wish you the best in your continued career and in your mentorship. I appreciate the work that you do for all these folks who are out there wanting to learn and to grow in the profession.
Thank you for having me.
And that wraps up today's episode of Philly Public Health Chats. I want to extend a big thank you to Dr. Carlene Robinson for sharing her incredible journey in public health, her insights on mentorship, and the importance of community engagement. It's clear that her work in rural health, social epidemiology, and data evaluation is making a significant impact. Her dedication to mentoring the next generation of public health professionals is truly inspiring. If today's conversation resonated with you, or if you're someone looking to explore a career in public health, mentoring might just be the key to opening up new opportunities. Remember, whether you're seeking guidance or offering it, mentorship is a two-way street that helps both the mentor and mentee grow. If you enjoyed today's episode, be sure to subscribe and leave a review. We'll be back soon with more conversations highlighting the brilliant minds and initiatives that are shaping the future of public health. Until next time, stay healthy, stay informed.